Multiple sclerosis, or MS, is a neurological disease of the central nervous system, where your nerves no longer effectively receive signals from different parts of your body. The signals are slowed down or blocked by lesions, which are areas of damage caused by inflammation, as a result of an immune system attack. In about 80% of people living with MS, messages between the brain and bladder are disrupted, causing urinary incontinence or bladder problems. Bladder problems can greatly affect your quality of life and your willingness to join social activities. Many people find this embarrassing and may not discuss this issue with their MS healthcare team, but it's important to share, as there may be options for treatment and management. In normal bladder function, the bladder receives urine from the kidneys. Muscles in the bladder wall expand to store urine, and the muscles in the urethra contract to hold urine in. When the bladder is full, the bladder sends signals to the brain through the spinal cord, which triggers the bladder muscles to contract and the urethra muscles to relax, allowing urine to flow out. The impact that MS has on the central nervous system can weaken or block the signals between the bladder, the spinal cord, and the brain. Depending on where your lesions are located, different bladder problems may occur. The three most common bladder issues caused by damaged or blocked signals are bladder overactivity, urinary retention, or a combination of both. With bladder overactivity, you may feel like you have to urinate, even though your bladder contains little urine. Symptoms include an urgent need to urinate, waking up to urinate 2 or more times at night, having accidents, smaller volumes of urination at any one given time. People with MS that have bladder overactivity can have unstable bladder muscles, causing them to squeeze more often than normal and before the bladder is full of urine. Sometimes the urethra muscles are not strong enough and let urine pass before you're ready to go to the bathroom. With urinary retention, you may feel like you have to go and you push and you can't empty, or you go and you feel like you have to go again because you haven't fully emptied your bladder. People with retention issues may have lesions on an area of the spine which interrupts signals to empty. As there is no signal to urinate, your bladder becomes full, but you aren't aware of how full it is. For some people, MS can cause the bladder muscles to stop contracting before the bladder has been properly emptied. It's important to talk to your MS healthcare team for an accurate diagnosis and treatment plan. They may assess a number of factors that could be the cause of your bladder issues. Your mobility, for example, ability to get to the toilet. Your diet, if you have a urinary tract infection or UTI. Any medications you are on to see if any could be contributing to your symptoms. They may also ask you to keep a bladder diary, monitoring frequency and volume of urine for a period of time. Urinary tract infections, UTIs, are a common infection among people with MS. Approximately 80% of people diagnosed with MS will have a UTI. And UTIs can often be the first sign of bladder problems. UTIs may also lead to relapses and/or more serious health complications. People with MS that experience a lack of sensation might not notice signs of a UTI that others would. Signs for a UTI can be similar to bladder problems. For example, frequent urge to urinate, or only passing small amounts of urine at a time. But be on the lookout for additional symptoms like painful or burning sensation when urinating, cloudy urine that smells unusual, fever. UTIs can cause a pseudo-relapse. Watch for worsening of symptoms like vision problems, cognitive changes, pain, weakness, and spasticity. There are many treatments and management options available. There are also some preventative steps you can take. So it's important to talk to your MS healthcare team about what approaches might work best for you. Treatments for bladder problems will vary depending on the type of bladder problem you have, but could include behavioral modification, pelvic floor physiotherapy or bladder training, which can be done preventatively as well, medications, electrical stimulation, surgery, or other appropriate interim or long-term management solutions. For more detailed information on types of treatments and management solutions, watch our next video.